Hello everyone, greetings from Pakistan, and I'm very thankful to 15th SEDEA Annual Conference of Egypt to provide me this opportunity to share my views about hyperglycemia in pregnancy guidelines. So with this, I would like to share my screen and my presentation. So I start in the name of Allah, the most beneficial, the most merciful. Again, a big thank to my dear friend, colleague, Professor Lubna Al-Tuni for providing me this opportunity to share my views on 15th SEDEA Annual Conference of South Egypt of Diabetes and Endocrinology. To share my views about guidelines for hyperglycemia and pregnancy, IDF MENA region. So the first question is that why guidelines are needed? And how IDF MENA region guidelines on hyperglycemia in pregnancy different from the existing guidelines on diabetes in pregnancy. So we have been listening to the stories of despair and despondency in our clinical practice. But some stories, they freeze our thoughts, they freeze our legs, and we need to think that what is happening actually with the women who are suffering so much. So this is the story of this is the history of Mrs. X, 35 years of age. In her 7th pregnancy, she presented at 16 weeks of gestation. But in spite of this being 7th pregnancy, she had none of the children alive. She was diagnosed as a case of GDM in previous pregnancies, but treated with improper doses of oral hypoglycemic drugs. She was married since 15 years and was continuously facing pregnancy losses due to diabetes during pregnancy. All previous 6 children had intrauterine death at 7 to 8 months of pregnancy. She came to us in January last year, and her diabetes was not only diagnosed but appropriately treated, and she had a cesarean section due to pregnancy-induced hypertension. This 7th and the only live child she got after 6 pregnancy losses. So lack of timely screening, diagnosis, and improper treatment costed this woman years of despair, deprivation, social stigma, physical and mental anguish, and the joy of motherhood she could never enjoy. We, the healthcare professionals, do we have any justification for this inertia and omission? Considering all this, an online survey patterns among healthcare professionals of screening, diagnosis, and management of GDM was conducted in 18 countries of South Asia, Africa, and Middle East through Professional Diabetes Association. And our very dear friend, Professor Dr. V. Mohan and Bhavandrani Balaji were with me in this survey questionnaire. And the aim was to identify the screening methods and diagnostic criteria used for managing women with GDM in respective countries. And to our surprise and to our great surprise, we found that screening methodology was inconsistent, and so were the screening criteria. Almost 59% of the healthcare professionals followed the two-step process. The criteria of IDA-SPG was used only by 36% of the doctors, and 1999 criteria by WHO was used by 27% still. And almost the same number reported to follow the American Diabetes Association criteria. So first, because of this emotional turmoil that we come across every now and then about pregnancy losses and women suffering, and then the scientific evidence that we found, the scientific published evidence that we found, I just shared a few slides from them. We felt that we need guidelines to diagnose and treat the women with diabetes in pregnancy. And according to our cultural, socioeconomic status, lifestyle, nutrition patterns, beliefs and norms of MENA region. And we see that the prevalence of diabetes is increasing. 1 in 11 adults had diabetes, and proportion of men with diabetes is almost equal to that of proportion of diabetes in women. Relative and adjusted risk for diabetes in women with prior GDM is 7, with odds ratio of 17.9 for MENA region. And hyperglycemia and pregnancy in women in IDF MENA region, if we look at 2019 statistics, age-adjusted comparative prevalence was 7.5%, and 1.9 million live births were affected by with diabetes in pregnancy. And in MENA region, 1 in 7 live births are affected by hyperglycemia in pregnancy. These are the latest figures available from IDF Diabetes Atlas 9th edition. We can see the countries, the gray area, the countries and territories without data sources on hyperglycemia and pregnancy. And this is because of lack of agreed definition on hyperglycemia and pregnancy, and also lack of agreed screening protocols among these countries. So therefore, these do not surface in the statistics of GDM. The purpose of the guideline was to create uniformity of care, at least across this diversified region, which is called MENA region. I was privileged to chair the first hyperglycemia and pregnancy guidelines, which was initiated by Society of Obstetrics and Gynecology of Pakistan. This society was formed in 1957 and has the highest number of members of all societies in Pakistan. So we initiated in September 2009, and it took us 9 months to complete the guidelines. And finally, these were published on 25th December 2020 in Journal of Diabetology, an official journal of DAS, Diabetes in Asia Study Group. And these were the authors from Pakistan for this guideline. So we found that the secret of getting ahead is getting started, very rightly said by Mark Twain, because I had never written any guidelines before embarking onto this Pakistan hyperglycemia and pregnancy guidelines. The first suggestion, now where we started in MENA region, So the first suggestion to write IDF MENA region guidelines for pregnancy with diabetes was initiated on 29th August by Professor Jamal Belkader, our chair, IDF MENA region. And I was at a total loss as to how to start and where to start, which is agreeable for 22 countries of MENA region. And a Zoom meeting next week was started with Professor Jamal, chair, MENA region, and President IDF-elect Professor Akhtar Hussain. And after about a fortnight, a MENA region, 6 members from MENA region meeting was started on the first EDM guideline committee meeting and was held on 16 September. That is 15 days after the first suggestion. In-depth review of global clinical practice guidelines was undertaken. There are about 28 online Zoom meetings every weekend, lasting for 2 to 3 hours. And the pilot testing was also done for these guidelines. And the timeline decided was about 8 months. And as you remember that we started with 6 members from IDF MENA region for the start of guidelines. And as we went along, 29 members from 19 countries of MENA region, they joined us. And by the end of March 2021, the task was completed, well before we planned to complete it. The approval for publication was received in 2021 June, and finally on 22nd July, it was published in GOD. It is available online, and if you just put IDF MENA region guidelines for management of hyperglycemia in pregnancy, this is probably the latest guideline on diabetes in pregnancy available online. So what are the highlights of IDF MENA region guidelines? There are a number of guidelines available. So why we needed this MENA region guidelines? So this is the first comprehensive evidence-based, locally tailored guidelines. authored by a multidisciplinary group of healthcare professionals. An uniform strategy was given for screening and diagnosis of hyperglycemia in pregnancy because, as we saw earlier in the survey, there was a total state of confusion among healthcare professionals about the screening methodology. The format is clear, user-friendly, offers pragmatic recommendations for clinical practice. And as I said, that contribution of 29 authors from different countries of MENA region for authoring various subsections of guidelines. These were the subsections. I've just shared a few of them with you. These were the topics and these were the authors. So the recommendations for blood sugar screening was uniform, that is early universal screening on first antenatal booking visit, irrespective of risk factors, was recommended in view of the early GDM coming up, especially in Southeast Asia and MENA region. And we recommended 75 grams of oral glucose tolerance after 8 hours of fasting, not 12 hours, but 8 hours of fasting in pregnancy. And International Association of Diabetes in Pregnancy Study Group diagnostic criteria was used, which is if it is more than 92 milligrams per DL, 180 milligrams, that is fasting, 180 milligrams first hour, and 153 milligrams per DL 2 hours after glucose load. Fasting blood glucose was another screening modality whereby 126 milligrams, more than 126 milligrams, was used as a cutoff criteria. DIPSI method, that is Diabetes in Pregnancy Study Group India method, was used where fasting was not needed. Those women who cannot come in fasting during pregnancy, they were allowed 75 grams of glucose in 250 cc of water to be taken over 3 to 5 minutes, and only one blood glucose sample was taken, that is 2 hours after ingestion of 75 grams glucose load. And here the diagnostic cutoff was more than or equal to 140 milligrams per DL. HbA1c was used, however, but not as a screening test. So we recommended OGTT, fasting blood glucose, and DIPSI criteria. Prevalence of obesity in MENA region is enormous, and there is absence of standardized guidelines for physical activity in MENA region, especially for youth and in pregnancy, needs to be addressed by focused diet and lifestyle interventions. So pictorial guidelines for lifestyle and exercises during pregnancy is given in the guidelines. All these pictorial diagrams, they were made by one of the authors of our guideline committee. Then recommendations of calorie intake and weight gain during pregnancy according to BMI was mentioned as per our situation, our regions and our countries. And DRI for pregnant women was also indicated. Then recommendations for type and sources of oils and fats. There's an extensive recommendation for the use of oil and fats. And food groups for daily meal planning was also given. When it comes to neonatal management, there's an extensive neonatal management strategy is given in the guidelines. And as most of us are in a habit of doing blood glucose with a heel prick in neonate, immediately the child is born in OR or in labor room. But this practice was discouraged, and the cutoffs, which are sometimes a source of emergency in a neonatology unit, they were also very nicely defined. That what should be the cutoff for neonate to initiate the treatment. Likewise, breastfeeding recommendations, though they were there in other guidelines also, we provided the links to educational videos to help promote and support breastfeeding. Now, this McFeel eligibility criteria by WHO was modified. This is a contraception method in hyperglycemia and pregnancy according to the use of estrogens and progestrogens, and oral pills was modified in patients with hyperglycemia and pregnancy, those who are seeking advice on contraception. Now, insulin injection techniques during pregnancy. In the first trimester, this again was elaborately defined. No change in insulin site or technique is needed, and women should be reassured. While in second trimester, and also in third trimester, because of stretching of skin over the central abdomen, lateral sides of the abdomen were recommended for injections. And those patients who were very apprehensive, they were advised to use the sites like thighs. Pictorial guidelines for insulin injection techniques by pen and syringes were also provided. All these pictures were taken personally in our old clinics and inserted into the guidelines. Then similarly, insulin handling and storage was also pictorially demonstrated in those areas where electricity is not available, scarcely available, or because of this load shedding. Most of the time, the electricity is not available for hours, so where to keep the insulin. Management of diabetes in pregnancy during Ramadan. This is not a topic which is included in almost all other guidelines. We included this topic, and we are thankful for the authors to provide us the guidelines for diabetes in pregnancy during Ramadan. So the question comes at who will be the end users of the guidelines? Obviously, obstetricians, family physicians, and internists, and all these healthcare professionals are the end users of the guideline and have been the end users of the guidelines in other guidelines also. But here we have made it practical and very easy to be used by the nurse practitioners as well. And now the questions comes that will these guidelines be of any help to know the prevalence and gravity of situation in MENA region, or it will be another piece of papers which will be shelved. So to make sure that the guidelines are used, Pakistan National Registry for Hyperglycemia and Pregnancy has already been introduced in Pakistan last year on the day of World Diabetes Day on 14th of November. These registry will provide us the evidence that the guidelines are being used, and we intend to share these guidelines with our friends in MENA region also. Finally, the guidelines are intended to assist in the provision of optimal clinical care and to make informed decisions with full responsibility and not to override or supersede clinical judgment. Obviously, we, the senior people, are well versed with the clinical judgment, but these guidelines will provide an opportunity to form and informed decisions. The next revision of these guidelines is intended after 2 years. And I'm thankful to Dr. V. Mohan for final review, guidance, coordination, and accommodation of guidelines in the special issue of diabetes and pregnancy in Journal of Diabetology. And it would not be out of place to say that he deferred the issuance of this special issue of diabetes in pregnancy for about more than 1.5 months because our guidelines were in pipeline. Many thanks to Professor Akhtar Hussain and Professor Jamal Bil Qadir for provision of guidelines and placing their trust on Chairperson Guideline Committee, that is myself and the collaborative group of authors. And I'm thankful to all friends in leadership position of IDF MENA region for their support and nomination of members to the collaborative group of authors. And thank you, authors, for the passion, inspiration, and insane amount of time to craft these guidelines. And these authors are from the different countries of the MENA region. We did not stop here. And after we finished with the guidelines, under the leadership of Professor Ahmed Bilal, and this was the brainchild of Nadima Segin from Jordan, that we should have a book written on hyperglycemia and pregnancy. So Diabetes in Pregnancy, a journey into past, present, and future of care is authored by 135 authors, and there are 61 chapters, and 25 countries are included into it. There are 7 poems written in this book. All the sketches that you see, this is the title of the book, and all the sketches that you see have been hand drawn. None are taken, none of the pictures are taken from outside. And I'm thankful to Professor Ahmed Bilal, the Dean of Medicine in Faisalabad University, that he took the lead, he and his team took the lead in crafting and designing this book. And finally, this was launched. This book was launched on 12th of March this year, and it is available, not yet online, but it is available, and I hope that we'll be able to provide a few of the copies to our friends in Egypt. We already have provided 130 copies of this book in Jordan to Professor Nadima and our friends in Jordan. So thanks to Professor Lubna Al-Tuni, the organizers of the webinar, the chairs, panelists, and friends for active listening and taking time out of their precious busy schedule. Question and answers, I'll be available to answer these. And thank you again, once again.